we're talking about our sexuality and disability specialty. And Lourdes, tell us a little about the challenges an autistic person may face when they begin dating and wanting to engage in sexual relationships. What are a couple of things that you would be teaching?
So one of the most important things is to think about behaviors. What are appropriate behaviors? Some of the difficulties that an individual may face is not being able to read nonverbal behavior, right? Like, does somebody want me close? Does somebody not want me close? So it's important to educate the individual to what's appropriate socially in terms of approaching someone, right? Another difficulty may be understanding certain things, like certain people are not into touch, right? Some people like to be touched strong. Some people like to be touched soft. Some people don't like to be touched. So one of the things that we can teach when you're trying to date someone or get involved with someone is maybe having a contract that has worked in the past. These are the things that I like. These are the things that I don't like. Or asking questions appropriately. Is it okay if I give you a hug? Is it okay if I invite you out to go to the movies? Little things like that, that will really, really help in initiating that contact.
Okay, and thank you. And Dr. Green, as a surrogate partner, how might you work with someone who's on the spectrum and wanting to start a sexual relationship?
Well, what I do is a client will be referred to me by a therapist always. And that therapist will give me an overview of the client's concerns, or their concerns that they've learned about as they've worked with that client. And so when I meet the client, I have that information. And then when we sit and we talk and we get acquainted with each other, if they're comfortable, I always say they have to feel somewhat comfortable, but they're there for help. We go into my bedroom and I will ask them exactly what Lourdes says. Where do you feel comfortable with me touching you? If they feel comfortable with getting undressed with me, that is one way to go about it, but that's never been the case with most of the autistic people that I've worked with. They are more comfortable sitting on the edge of the bed. We talk, we discuss what they like, what they don't like. Sometimes we get into what they fantasize about. And, you know, we start our conversation that way. They have to feel comfortable with me though. And that's because we do move into being more touchy. And if they're not comfortable with touch, I find out where on their body they would be okay with being touched, like the hand, the arm, the shoulder, maybe the face. You know, we take it slowly and respectfully.
Okay, so basically you have the opportunity to allow them to practice, you know, touching and being touched, so then they can discover what they want, what they're comfortable with, and then you would practice how they would share that information with another person.
Exactly.
With an actual potential person that they're, you know, looking to have a relationship with.
Everything is geared to the future for them, with being more informed.
Wonderful, thank you.